Thank you. At the outset, I'd like to thank Ajanta and Dr. Ragini and Dr. Lahane for this kind invitation to this wonderful gathering. I'll be quick. I know I'm standing between you and dinner, and I have only 12 slides, which get over quickly. So I'm just going to share an interesting technique, which I just kind of stumbled upon on my own when I was dealing with soft cataracts, and all of us do struggle with soft cataracts sometimes. So I call it the push and flip technique. So basically, what the premise of this technique is that we are using a cannula or a spatula to push the posterior part of the lens and roll it against the capsular fornix. One second, please. So, what are the problems that we face with soft cataracts? Whenever you're trying to kind of crack them, it's difficult to crack sometimes, and even if you're trying to get a grasp, it tends to cheese wire, and you'll end up often creating a crater or a bowl, and then you don't really get a grip to kind of bring the nuclear pieces forward. And in trying to get it, you could damage the zonules, you could end up causing a rent in the capsule, and there's a lot of things that can go wrong if you're not careful. So the traditional techniques are you try to kind of prolapse it out using either hydrodissection or viscoprolapse. You go underneath or peripheral to it and viscodisplace it centrally or anteriorly. And then you either take the whole nucleus or fragments of the nucleus and then aspirate, emulsify them. Or if it's very soft, you could just phaco-aspirate the whole thing without using phaco-energy. But these don't always work, and sometimes one does end up struggling. So this is how I stumbled upon this technique, and I like to call it the push and flip. So this is what we're doing. We are basically putting a visco cannula or some sort of an instrument in the depth of the nucleus. So if after you've done achieved some sort of a separation, and you got these two heminuclei or four pieces, and they're just not able to pick them up, you go into the depth and then you basically push it mechanically against the fornix of the bag. So use viscoelastic, and as you're injecting, you push it against the periphery of the capsule, and essentially because the side of the nucleus is round, it rolls against the side of the capsule and it flips over and becomes inverted. And then you can easily emulsify it in the supracapsular plane. Okay, so this is in an animation what you're doing with your cannula. You're just pushing in the depth, not absolutely at the posterior plate, but close to it. And then the vector forces are such that it kind of rolls the piece out. And I'll just demonstrate the same thing. So, here we have achieved a crack, and I was trying to grasp it, but it wasn't coming. And as you could see, I went into the depth and just kind of pushed it, and it rolled out. I'm sorry, the video is not coming out very clear on the screen, so I'm not sure if you could appreciate that. I hope it'll be better in the. And then once you rolled it, you're basically then you're catching the posterior part of the nucleus and then emulsifying it with your probe like so. This is again, you can see that trying to grasp, but it's becoming a bowl like a crater, and it's not able to catch the nucleus. And here we are using the Sinsky hook in the posterior part, just pushing it, and then you can see it rolls over and comes out. I'm sorry, it's not very clear on the screen. And then same thing is repeated on the other heminucleus. Sometimes you could even just do it to the phaco probe, but if it's not happening, just use either a Sinsky hook or a cannula, and you can see it's just rolling against the phonics of the capsular bag and comes over. So the idea is you use the phonics of the capsular bag as a kind of a support against which the heminucleus will roll. This is a patient who's had a femto cuts with the Zima femto, and same thing with the cannula. We're able to kind of turn the piece against the phonics of the capsular bag, and then you emulsify from the posterior aspect. Here the video is slightly better, so hopefully you'll be able to see. So we're trying to grasp, and you can see it's cheese wiring. It's not really coming into the phaco tip. It's not very soft, this nucleus. So I try to turn it around to another side. Again, it's not really kind of cracking easily, not turning. So I resort to my other technique, which is a push and flip. You can see I'm using visco to kind of separate the pieces a little more. And then I've magnified it. So we go to the posterior part of the nucleus. And as you're injecting, use the tip to kind of prod that, and you can see it flips against the fornix. And once you have the posterior aspect of the nucleus presenting there, you can easily grasp it with it. Now we have this heminucleus again in the middle, just pushing it and rolling it out so that the posterior aspect of the nucleus is in front, and then you can grasp it with your phaco probe and emulsify it. So next time you struggle with a soft cataract, I'll urge you to just try this out and you'll thank me for it. So that's it. It's a simple technique. I just thought I'd share it with all of you. So the push and flip is a useful technique to tackle soft cataracts. For very soft cataracts, you could just use an OVD cannula in the depth of the nuclear plane, injecting OVD as you push the posterior nucleus gently towards the capsular back fornix. For grade 1 to 2 cataracts, you can use a spatula or a Sinskey hook and do the same thing. And this can be done either with irrigation on from the phaco probe or with an OVD in the eye. Thank you.